Hi friends, hi. My name is Joyce. I am the face behind Joy and Hope. And today I've got another one for you guys. And this time I'm talking to the men. So today we're talking all things prostate cancer. So it is quite a common cancer amongst the males. And I thought it's worth us talking about that so that we can know what signs and what are the signs and what to do about it. All right. So I'm Joyce. I'm a physician associate in general practice and I live in the UK. So prostate cancer, a few famous faces have had prostate cancer. We need to be aware of who is at risk of prostate cancer, the Black community, also your age, if you're of advanced age, i.e. if you're above 50. The other thing is your lifestyle. So if you're someone who is overweight and if you're eating a lot of like unsaturated fats and eating a lot of red meat, that increases of prostate cancer. And then also your family history. So if there is a family history of prostate cancer, that increases your risk of having prostate cancer. All right. So I think for most of us, what we need to know is what are the signs of prostate cancer. All right. So the signs of prostate cancer are very similar to the ones for urinary tract infection. So you might find that you might have increased visits to the toilet, but when you go there, you will pass some urine, but not much. And then within a short space of time, you need to go back to the toilet. And again, you don't pass much at all, or sometimes you pass nothing at all. But you have that sense or that you need to go to the toilet. All right. And the other thing is when you do pass urine, you would notice that your stream is weaker. So again, that's another sign of possible prostate cancer or an enlarged prostate. All right. So the other thing is you might notice that you might have blood in your urine, and that's another sign of prostate cancer. The reason why that happens is when there is malignancy in the prostate, it becomes bigger, doesn't it? So those are the signs and symptoms of prostate cancer. All right. So if you have those signs, take yourself to the GP. What they will likely do, they will test your urine, test for a urinary tract infection, and also testing for any blood in the urine as well. What the other thing that they will likely do is to do a blood test, which is called a PSA blood test, which tests for it's a marker for prostate cancer, although it can be high for other reasons as well. For example, if your prostate is enlarged, but not due to cancer. All right. So they will make their assessments and do those tests. They will likely also do other blood tests to check if there is cancer there, i.e. if there is any spread. So bone cancer as well, has it spread to the bone and stuff like that. So that's for your GP to consider and do as they see fit. You can have a PSA test if you're above 50 and you've got the symptoms that I mentioned to you. So you can have that done here in the UK. In terms of treatment, what is the treatment for prostate cancer? Similar to breast cancer, you can have radiation treatment, you may have chemotherapy, you may have hormone therapy, you could have surgery as well. Or sometimes they might, depending on the situation, they might maybe approach the watch and wait. So they're watching and just keeping tabs on it, but not treating it at that point in time. Usually, if it's not getting any bigger, and maybe if the situation does not allow for these other treatments to be done. So what's the prognosis? So for prostate cancer, it's very, like with all cancers, it's very important to catch it as early as possible. So that's why it's very important to know what the signs and symptoms are. All right. So if it's caught early, then the higher your prognosis is. All right. So I hope this has been informative, and I hope that has been helpful to someone. So if there is someone you know who you think this information would be helpful to, then please share this with them. And also you can like and you can subscribe. All right. So I hope to catch you later on another video. Take care. Bye bye.